The next section I'm going to cover is talking about synthesizing the evidence that we found in our articles. So while looking at the evidence from the articles and putting it all together, we as a group highly recommend the use of PCA pumps in patients that are post-op, post-surgical, to improve their pain level and to provide a better pain outcome and provide more satisfaction for the patients. Based on our findings table that was reviewed, the article provided with quality evidence that showed the benefits of using a PCA versus having a nurse administer pain medications on a PRN basis. These articles also gave more information about the use of PCA and suggested patients' education and knowledge as a big factor while considering the patient's use of PCA pumps and how it improves and increases patients' pain level and satisfaction. So the first article that I want to bring up is a really good evidence that talks about PCA pumps versus IV injections for pain medications. This article is by Nurse Hong, who's part of the Department of Nursing in Korea, and he suggests that using a PCA pump will benefit the patient because it improves the pain level while also giving nurses time management skills to care for the patient in other areas. This article also talks about cost and education needed for the patient using PCA. A quote I would like to bring up is that the mean post-op pain level that was taken every 2 hours, every 6 hours, and every 12 hours in patients with PCA was much lower than patients using IV injections. Another article that we brought up was done by Sima Lagdiazi, who's an RN in Tabriz University of Iran. And her article and study showed similar results with pain in patients with CABG, post-op patients. Her article suggested that patients using PCA had a pain level score of 0.75 compared to patients not using a pump and using nurse-administered analgesia, and their score was a 3.47 on a scale they used. These numbers can show a significant amount of pain and pain level satisfaction with patients that are post-CABG and other such surgeries. Another study done by Nurse Hamza in Saudi Arabia took a sample of 99 patients in surgical ward using a PCA and their effect on pain level and their ADLs performed after the pain relief. Out of that study, 63.6% mentioned better mood, and 49.5% of patients that were using a PCA reported freedom to be able to perform ADLs and other activities that were done in the hospital. So like these three articles suggested, we recommend using a PCA pump for patients that are post-op rather than doing a manual or other forms of medication administration because it improves patients' level of satisfaction and their pain level is improved by using a PCA. All in all, you can see by using proper education methods and having a proper knowledge base for the patient is a good way to have the patients use the PCA pump more frequently, which will benefit the patient in long term while recovering post-op. Therefore, using a PCA pump will benefit not only their pain level, but will reduce their anxiety, will improve their mood, and make them able to participate in other activities such as physical therapy to recover more rapidly while they're post-op. Through the literature review, we were able to feel more confident in suggesting a PCA pump to post-op patients on floors like ours.
Two of the surgeons that work really closely together at Gwinnett Medical perform almost identical procedures before sending their patients to 7 North, which is the floor we're located on. One of the surgeons prefers a patient-controlled analgesia post-operatively for 48 hours, and the other one prefers intermittent nurse-administered medication on a PRN basis. We would propose to the clinical resource team on the unit a study for the first 30 patients that come to their unit from each surgeon. We would follow them for 48 hours post-operative. There would be no extra intervention, and the nurses wouldn't have to go out of their way to do anything else for these patients other than provide the care they would normally give. The parameters for this study would be that the patient has zero history of drug use, no allergies, limited comorbidities, they were above the age of 18, could consent to the study, and could swallow with no issues. After reviewing multiple articles, we found a survey we think would really encompass all of the factors that would be necessary to prove clinical significance, including an accurate pain level after educating the patients on a 0 to 10 pain score, patient satisfaction, education on pain medication provided to them, and the ability to ambulate and perform activities of daily living, adverse reactions, and fear and anxiety related to pain medication. We realized halfway through the semester that a lot of patients don't understand the difference in pain medications, and they often ask for the lowest pain med possible, or one that they're familiar with, not knowing that another pain medication could relieve their pain. This survey would be given at 6 hours, 12 hours, 24 hours, and 48 hours post-operative, and would be assessed in conjunction with a thorough chart review. We also would like to interview surgeons and nurses on their expertise to provide rationale behind what they propose as the best post-operative pain management therapy. We think this study could be beneficial in looking at nurses' response to pain calls, pain management, and patient satisfaction of the patient using each of these pain management methods.
In conclusion, after reviewing all of the articles and critically appraising the data we collected, we really do feel like using patient-controlled analgesia pumps would be beneficial to the patient population that we addressed in our PICO question. Staying on top of their pain is a key in dealing with the postoperative patients so that they are able to start physical therapy, occupational therapy, and sinus spirometry and discharge planning. Overall, it produces a better outcome in our patient population as well as helps a nurse have the flexibility to provide holistic care to their entire patient load. After proper education of pain medication by the surgeon and physician team, patients are able to feel more in control of their pain management, have less anxiety about their pain levels, and can receive medication on time with no further delays. Because of the ability to give their own medication on time when they feel necessary, they are not dependent on the staff to provide relief of their pain. They have the ability to continually provide pain relief for themselves so that they are not scheduling PRN medications every few hours. This also provides the nurse relief when trying to schedule their medications for the shift, especially if they have multiple comorbidities. In conclusion, we feel that the clinical significance of PCA pumps post-op that we found in our review of articles is strong enough to be recommended for post-operative patients. Thank you.